Ahoy there, I'm TinyPirate and welcome back to Project Hospital. I know a bunch of you have been very excited to see more videos of this and I'm very happy to provide you with some more. So that's great. The game is out, I believe, on Steam. You can go and grab it right now. Now, some of you may have noticed I've deleted a waiting room here, and what I've realized is we see all these chairs here, we're getting pretty full, and I'm thinking I've shoved a couple of doors on the cleaning closet. I'm thinking of putting in another doctor's office right about there because, and we're going to just like tidy up these rooms as well in due course, because we have a bit of a need for, and I'm going to put just a small corridor, and you see I'm still bugged by my ridiculous corridor size that's going to just annoy me forever. So I'm going to put a small doctor's office in here, and then I'm going to put the radiology waiting room down here because we do have the room for that. And if you look carefully, a few of you may have noticed that I have gone and colored the walls, and that I'm going to continue with, not orange. We're going to have a red top and bottom on these walls because this is the kind of, what is this? This department, emergency and hospitalization. So yes, we're doing it. We're doing it in this fashion because I absolutely feel like it, which is a good reason to do anything if you've got a game, isn't it? So I've just made these so I can see one for each room. It's not quite square, but if I put it into the corner, you can't really see it. What do we need? We need a door. So we will put one about there. And then we shall jam in, there we go, we'll jam in all the equipment we need. I think I'm going to put that a bit further away. A little square table here, which is where we like to put, I'm going to put actually the odometer there. No, that's not the odometer. You know what I mean. The examination light there. So that's made those things less difficult to handle. We're going to put a tray of equipment right there, and the office desk and the printer can sit about here. We'll put the couple of chairs in. We'll get a printer because we're generous with our things, with our staff. Put the little spray there. Give them an eye test in case someone is blind and hopeless. And where's the computer? The computer is there. Another table, I think, in the corner. Got to rotate it properly to put an audiometer. Stick that there. I generally like to give the doctors a sink. I'm not always super diligent with that, I must admit. In fact, I might give them all a sink so they can all wash their hands after treating someone. And we'll give this guy a sink as well. No exceptions here. We're not playing favorites. Although this guy clearly is the favorite. Or lady. We don't know yet who's going to work here. A wall-mounted. I like these sort of equipment cabinets. I think they look cool. They look very professional. Actually, could we put that like that there? Oh, we could, which means we could actually sell that, which would be... Bloop, just deleted it. Would I want anything else? Something fancy maybe, like a bookcase? This is clearly, I almost think this should be like the chief's office. Like House's office, which is kind of lame to think about. We don't have House in this game. So I'll just maybe, tuck this over. I'm going to move this closer to the door, next to the sink, that into the corner. And I'm pondering, do I need anything else in here? It's actually looking pretty good. I think we're okay. Yeah, anyway, I think that's going to be fine. So what I really want to do now is hire someone. So we need to have a doctor who's going to come in here. They're going to work on the day shift. What are we looking for doctors here? Now I've got to remember that what are required? Acute medicine. And this one is an early bird, long commute. That's okay. An early bird and a long commute should cancel each other out. Acute medicine and advanced diagnosis. This chap looks pretty good. No one else is as good, and we're a little poor, so I'm not going to go and make a bunch of different diagnostic efforts. What I need to do now, though, is I need to sort out a waiting room because we did we did forget one over here. So let me just remove that. We need a waiting room for radiology. So I need to flip over to radiology. Give me radiology. They need a waiting room. And I can back that straight onto the doctor's office here, I think. And do we have 2 corridors? There's a corridor there. I want to get a corridor sorted for this facility here. So I'll see if we can do it like this and make it one big corridor. So that's a corridor. This is radiology or general's corridor, sort of corridor, and I can't remember who. And with that, I can now lay out. Where are we? I can lay out the green for this waiting area. And again, I'm just going to make it kind of pretty, like in that fashion. And you know what? I think I'm going to put some back-to-back chairs like this so we can fit everybody in. They need a queuing thing and they need an informational TV. So that should be, I think that should be it. And now I can press play or slightly fast forward. So this doctor's here ready to go. And this one is definitely the most well appointed of the doctor's offices. Did I miss anything? Kind of feel like I should have put like a little equipment tray in or something. We'll look a little bit nicer in here rather than these big desks at the end of the tables, but that's fine. So we do still have quite a few people, but I'm really hoping to be able to hit all of the patients treated. And I don't know. So this is 30 patients coming in. Our next goal is 40 patients, but we're not going to hit it. Not right now anyway, because I just don't think we're going to have them in the building, which is a shame. But we do have important goals to deal with, and that is to unlock a general surgery department clinic. So, well, we've got to open a general surgery department clinic. And that is this one. And yeah, this is going to be quite an ask. I think it needs its own, well, we don't need all of those things. We need a general surgery office and we need a waiting room. So I could actually do this right now. I mean, I could put another waiting room in here and I can happily make that a good size. And I'm thinking of like, well, we're going to have to buy some ground. Do I have any cash? I have a little bit of cash and that's all I really need. So I'm just going to drop these walls now that we've had a look. Oh, well, here you go. In case you didn't already see it, you can see all the pretty walls there. So we need to drop all those walls. And we need to build out our foundations a little bit and build some walls. So the general surgery office feels to me like a kind of a, well, it is kind of a blue place, but we've already done blue. So I'm going to go for maybe a very cheerful orange. We'll get these walls in the right shade now. Put it on that side like this. And again, floor tiles, white. And the general surgery office is, I see this is where I think I'm a little confused. I think it's because I'm not American, so I'm not as familiar with the US system. Like to me, coming in here and getting a visit to the doctor is like what you do every day, and I need to read this information, I think. So the general surgery office is, it's not telling me much about it, but the general surgeon office, I think, is just a general checkup, outpatient, so nothing critical, just people coming in for a bit of a look. And we can do a bit of a look. We're going to put our door here. What does it need, this room? So actually, let me just come back to, oh, here we go. Come back to my general surgery office. Oh, I see general surgery office. Got to lay it out first. Bam. So what do we need in here? I definitely need an exam table. It's always a good thing to have, along with, you can go for these medical examination lights or these ones. I prefer these ones. They look more stylish. I'm going to try for the equipment on a tray at the end. Yeah, I mean, that looks better, I think. Put the CPR equipment there. That seems to make everything very happy. Again, put the old spray here. The doctor will need, we've got some wall-mounted equipment and some, we'll go for the tall equipment chest there. A lab sink. Now, it seems that that one's a bit close to everything. We'll give the doctor their own little corner over here. This feels a touch massive. Like, I might just compress this office a little bit. I don't want to get too carried away with stuff. I mean, the doctors can be spoiled if you're not careful, right? That's the last thing we want, is to spoil doctors with their needs and so on and so forth. They're just going to get big ideas of grandeur about who they are and what they should be doing with themselves. Small stool. We do probably want... I'm going to put another one of those there. I wonder why that couldn't fit in that corner. Audiometer. Nope, that doesn't go there. Interesting. We'll get rid of that. We'll put it in one of the small tables because it seems to be required. And then we can slam on that. And I'm going to put that orange wall in. Now I'm going to put that in, like, zip along there. And I'm going to delete this room. Where are you? Room. Come here. Come here, room. And here we go. So room deletion. We'll just cut that off there. Okay, cut off the whole thing. Fine. And now all we need to do is probably hire a doctor, and I think we're looking pretty good. I'm going to give this one no option. It could be because we're a little broke. But no, I mean, that seems okay to me. We'll worry about what goes in this other room another time, but we will fix up the floor just because we can't possibly leave the floor looking so disgusting. That would be just weird. We're not into looking weird around this place. Well, we've got that room set up, so it's probably time to do the general surgery here. And so I do actually want to lay out the floor tile, which will, I think, actually be quite helpful to remind me what each of these facilities are. Actually, it's going to be very good in the long run. So I'm just going to run these lines down here to figure out, or to show off the colors we're working with, make sure everything looks kind of like it's been guided. Like this is where staff can... Why are you not working, little dots? Who knows? Oh, it's because it's showing the icon underneath. That's fine. So this little waiting room absolutely needs, again, rows of chairs. So we'll get some back to back like that. And we are going to have to put some kind of wall in, which I think actually is a touch annoying. We can probably put it there, but I don't think it'll count. No, it won't. So where am I going to put you? Am I going to have to put in like a very small wall? I feel like I am, which makes me feel like slightly weird because that chair is gone. So we'll put in this tiny wall and put an informational... Actually, they're still not happy with that. That doesn't seem right. So we'll make that wall slightly bigger. Wall. Are you not supposed to be there? Okay, so that's fine. Which means we can probably put that one there like that. And I think... Can we fit a water cooler in? Anywhere? That might be good. That's probably fine backed by that there. And a vending machine, I'm going to put one in over here just because I don't think the staff or the patients care where they go to get. I'm just going to maybe check another one. This was like a doctor's waiting room, wasn't it? Would it be... helpful here? No, no, it wouldn't. I think I'm just going to put it down the corridor for now. Okay, so that should actually be... That should be enough. Like, have we opened a general surgery clinic? It seems to think so. Oh, but we do. Wow, 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 wow. Hang on. We need 3 doctors and 3 nurses. So we're going to... I don't know. Doctor in on-call room. Waiting room. That's a place for people to wait and study. Oh, that's for hospitalization. Doctors. A clinic doctor that treats patients specialized in general surgery. Okay, so general surgery 32, 40%, 58, and operative. You seem pretty great. I'm going to see what your hidden trait is. A people person. Oh, you sound fantastic, Mary. General surgery is used for examinations, prescribing treatments at general surgery department. Oh, I see. So it's where you send people before you send them in for actual big surgery. Doctor director is a main surgeon. Okay, and affects how often they'll... So it allows them to act as a surgeon? Is that right? I think so. Insurance company can be contracted to send patients. Okay, so we've automatically grabbed her there. We don't need anyone else right now. And I think we're just going to make the chief surgeon Mary. Oh, that actually worked out okay. That's sort of making a lot of sense. We'll accept patients. Treat 1 patient per day. Hospitalization at general surgery department. So that's what we don't have yet. So we need to complete that goal. And then we'll be on our way. So it's nighttime, so let's speed our way through to morning. Well, the day shift... What? The day shift has started and we've already got a bad... Oh, well, guys, do all of the, like, urine and chest and do everything. What are they doing going off to... Just like, I'm going to click everything. Go... Are you coming back home? Yeah, so you are actually coming back to the hospital. We have to figure out if it's hepatitis B or influenza. That's just lazy. Who was your doctor? Christopher Scott? Huh. Do I need to switch you out for Robert Hall, the specialist? It might help. Objective complete. Treat 1 per day. Well, we did... What was your treatment, lady? Celiac disease, autoimmune disorder, blah blah blah, diet modification and antidiuretics. That's a good idea. We could hospitalize them and tranquilize them and do all kinds of stuff, but we'll just let them go. So that's good. We treated them, and now what we do have is the option to where are we? Yeah, we can actually start opening this, but it's going to be quite a bit of money. And it's a whole bunch of stuff. So actually I'm conscious that really this here should all be red because it's associated with emergency, and this should all be green because we're doing x-ray with it, and this should be the blue, but I think we'll just leave that for now. So this needs a night and day shift, and it needs a whole bunch of rooms. Can't be hospitalized. Okay, we're gonna have to send to another hospital. Yeah, we can't hospitalize them. That's just how it is. We can tell them that they should be hospitalized and just sod off, go somewhere else. Can't handle you. So I think what we're going to do is start borrowing a vast quantity of money and laying out our hospital. Build and hire staff for 1 surgery. Well, yeah, 1 surgery lab, and we get a 2,000 reward. So what would actually the lab look like? So I think what we can do at least is like, oh yeah, just give me foundations. All right, well, we'll do it this way then. What? Oh, we're broke, extremely broke. Let's just make that an $80,000 loan. It wouldn't be healthcare if we weren't like spending a pile of money on it. And lay down the floor, which we'll just do in white for now. Walls. Let's smack this lab out quickly and then start thinking about where we're going to go next for the next episode. So we're going to go like this. I like to leave the outer walls white, so we're just going to do that for now. And we'll put the door in. Restricted access? Yeah, maybe. It is the lab, so it's not what we're thinking of the other stuff. It's not like a room that anyone should visit. So the objective is a surgery lab, right? Yes. Okay, so it's going to be we're going to make it a pretty decent sized one. A lab desk. It's usually at least 2 of them. A bin at the door. We've got all this equipment. I think they're quite... Oh, a lab sink. Medical centrifuge. A microscope. Glassware. Hematology analyzer. If I can get away with less, I will. A lab shelf, which wouldn't work there. Like there. No, we actually kind of really do need a pretty chunky room for it. Because I also need the old PC and printer combo, because it wouldn't be a general surgery if we didn't have that, would it? I mean, that would just be crazy. The lab techs like to move around a bit, so we'll give them a little stools to perch on. Glassware, to me, I need, like, can I get away with... No, that seems wrong. What RIA? That seems to fit. A stool analyzer, relay. Well, you know, this fits in. So I can do a stool analyzer, and I can do lab glassware, and I can slide in a whole wall over here as required. Bam. And get rid of this one. Just save ourselves the room for another day. That is actually looking... Well, okay, yes, we need to just remove that, which is going to kill the whole room, which is a bit of a shame. Surgery lab. And... Oh, a sample storage. Oh no, it was right around the wrong way. We fitted everything in. That's amazing. Now, what we do need, though, is a staff member. So this would be like one of these. What do I need for this? The technologist needs to be biochemistry. Well, that's none of them. Shuffle. Oh, advanced biochem. Actually not. Master scientist, 35%. Oh, biochemistry. What am I saying? They're all wrong. But this one was really good. Gamer, so resting is faster. I don't want to do that. So, and a people person. Margaret, you're just a lady for the job. Objective complete, build and hire staff. And we get a $20,000 grant. Oh, nice. We can afford to go into that debt that we were in. Actually, I do want to fix their floors, because their floors are not quite right for our hospital. We live for strangely painted floors in this place. That's just how we roll. Wouldn't want it any other way. So there, I do like that. I'm really digging the markers. I can see exactly which waiting room is associated with which department, except for over here, which I should fix. I think I'll turn all of that red, maybe off camera. Radiology is green. Still a ton of people waiting here. This doctor's office is, well, remaining very busy. And I'm getting much better at jamming everything in, which is probably a good thing as well. Treat 5 patients per day at general surgery. Another $20,000 grant. I think we can afford to pay down some of our loans, which is very helpful because they're costing us vast sums of money. What else do we need to do? So reach $2,000 daily profit. We'll get a $2,000... Oh, we've got a whole bunch of objectives here. We'll get a $20,000 grant for that. That's going to be fantastic. And then we can work through 9 objectives. And then, really the next job for us, and it's probably going to be in the next episode, is to smash out these rooms here for hospitalization. Now, my thought is... I don't know. My thought is that I almost need to move this room, or I wish I could just pick up everything, cut and move it over one, because the fact that the corridor's 2 here and 3 here, it's giving me a very slight sense of rage that is, you know, it's just an issue. It's an issue some gamers like me face. I could actually fit in a little storage cabinet there, like a cleaning closet. Would I be able to do that? Yeah, I could actually do that. And then the corridor can come down here. And then I'm inclined to put in a corridor going this way. And maybe more double doors over here. So reception for the general surgery might be over here. I'm sort of thinking. I'm also sort of thinking that eventually we'll want to have like a road or a path coming in this way where ambulances drop people. But you know, it's probably time to think about tackling that stuff in the next episode. And in this episode to call it quits, just to watch how this goes, check how we are at midnight, and then see what happens next. Well, overnight we haven't achieved our $2,000 daily profit. I'm sure we will in the next episode. So I hope you will join me and do subscribe, because I've been really enjoying this and I plan to play it for a bit. I like base building games, I like cool indie games, and I hope you'll stick around. Until next time, good night.